Morning, everybody. Welcome to Turnaround Tuesdays. I am going to give everybody a few minutes before we get started, so I can turn on my, so I can open up my screen and put you on mute so I can see everybody who comes in. So I see, welcome Charlie, welcome Ben, Shay, I see you. I want to give it a few minutes as we have before in the past, so I will chit chat a little bit about the process of the convention coming up this week. We have been going through the process of delegates. We've been talking about our delegates for the last few weeks. We feel very confident. Our goal is to get to 20-25% of the delegates, make sure we're on the ballot. So I want to say, any of you delegates that are joining us this morning, or any of you delegates that have really gone through the process for the last month, it's been very hectic and a little bit crazy. But I want to thank you all for your support, and thank you for joining us this morning. Anyway, healthcare. Let's talk a little bit about it. I don't know if this is going to be an exciting topic, but I can tell you right now, it's a very costly topic. Healthcare, as we know, it's a battle going on both at the federal level and at the local level, both with our governor and our legislators, and both with Obamacare and Trump and the Trump care. But even with all Obamacare and everything we're talking about, we still have over 250,000 New Mexicans, almost 15% of our population, that does not have affordable healthcare, that has any healthcare at all. So what you're going to hear from our campaign, we're going to talk about healthcare, is really affordable healthcare, quality, and access, and I'll kind of break it down as we get started. But before we get started, I want to show you all this chart. This is a fancy chart that I have. Anyway, what I'd like to talk to you about, more importantly, is look at our healthcare costs. Now, probably 2 years ago, I don't know if I was for single payer. Well, I can tell you right now, I've come around, and I am for single payer for all in New Mexico. And let me show you why real quick. And I hope you guys can see this, and I'm kind of looking at my computer too, so I think you guys can see this. The average household income in New Mexico is $43,000. Now, I understand I'm an independent contractor. I'm an independent contractor in my business, but I want to make sure everybody can see this. These are my healthcare costs for my family. So, family of four, which is typical New Mexico, family of four. I actually pay a monthly fee of $1,350 a month. I hope everybody can see that. Shay, can you guys see that okay? I hope everybody can see that. So over a 12-month period, I spend $16,200 for my family, for Asher and Gage and Jackie and I. $16,200. We have a family deductible of $5,000. So total, we spend $21,200 on healthcare premiums and healthcare costs to basically cover a family of four. Now, with co-pays and fees, I went back with Jackie and I kind of checked everything. We spent about $2,000. We spent between $1,500 and $2,000. I'm going to use around $2,000 because there has been some years. Now, it may not be this high with other families, but with young kids and with women's issues, with women's health care and some of the stuff that I go through, between co-pays and fees, we spent another $2,000 on average by the end of the year. So think about this. Our family of four, which is a typical New Mexico family, we spend $23,200 a year on medical costs. And by the way, let me clarify, that's net. So that means I got to make about $46,000 a year just to pay for my medical costs. Now, the average household income is $43,000. Folks, even if these are costs, the average household in New Mexico, 54% of their costs are going towards their healthcare costs. When 30 years ago, it used to be 12-15%. Now that's crazy and ridiculous. You can understand why we have to talk about affordable care, quality, and access to health care. Then when we talk about affordable care, it's about lowering our cost overall. When we talk about quality, that's more doctors, nurses, physician assistants, and more facilities, which we'll talk about. When we talk about access, we're talking about better hospitals, early access, access to doctors, urgent care centers, preventative health medicines that we know are cheaper than going into the hospital or going to the emergency room. So that's what we're going to talk about. Now, let's talk about the affordable side. We feel with a single payer system, or some people call Medicare for All, or the New Mexico Health Security Act, which basically would allow the state of New Mexico to have a single payer system. we feel that we could lower costs between 35 and 50% on premiums alone. Okay, so that means that $1,300 that you saw me paying a month would only be about $700-800 a month, and that's probably more affordable. We also have an issue in our state, and let me make this very clear. On the single payer and healthcare system, over 1.7 to 2 million people a year will be paying into that, and we'll talk a little bit more about that. But as you have strength in numbers, as you have a bigger group paying into the pool, your costs lower, right? We always talk about the high-risk pool. The high-risk pool is that 15, that 12, it's about 8%, 8 to 12% of New Mexicans that go to the emergency rooms or don't have healthcare coverage that we're all paying for. And that's between $350 to $400 million a year. Now we have some plans that we'll talk about. We have some plans how Medicare for All or Medicaid or a single payer system can pay for that. But we also need to take a look at our nonprofits. We need to take a look at all medical institutions and make sure everybody's paying their fair share. Now our proposal is everybody pay a fair tax and move that money into the high-risk pool, or as a single payer, that high-risk pool is taken care of. So we literally eliminate $300 to $400 million. It's about $350 to $400 million a year in that high-risk pool, which, if you take a look at it, drives 30 to 50% of our costs. So by managing the high-risk pool on that and going to a single payer, we can literally drop our costs between $35,000 to $50,000, the experts are telling us. Now, I've come around to this, so I think it's an opportunity for New Mexico. We have to start looking as a whole healthcare, whole person healthcare system, and that's what we have to take a look at as we kind of move forward here. Some other things I want to talk about is today. Already, 52% of New Mexicans live on some type of government Medicaid or medical assistance. So again, one of the other things that we have issues with is pharmaceutical costs. We know our pharmaceutical costs are very high. So here's our two proposals. As we move to a single payer system, right, or Medicare for All, whatever you want to call it, you then have 1.7 to 2 million people within that pool, and now you can literally leverage and negotiate pharmaceutical costs down. Now, I have another proposal that we haven't really talked about yet, but here's our proposal. 99% of generic drugs are made in India and in Israel. You've heard me talk in the past, our economic growth, you've heard me talk in the past about Santa Teresa. What we can do as a state, and we should be doing it already, and as your governor, I'm going to propose this and move forward very quickly to this. What we can do as a state is already over 50% of people are on some type of Medicare or Medicaid assistance. So my proposal is, let's bring generic drugs into New Mexico. We can repackage it under New Mexico brand, right, following FDA regulations, and then we, the state, can sell it to our consumers. If we did that and just controlled our costs ourselves, we would drop pharmaceutical costs almost 80%, the experts are telling me. So again, another way to do that. Now, we feel by a single payer system too, that the Walmarts, the Smiths, the pharmaceutical industries would work with us and we can drive costs down on pharmaceuticals. Keep in mind, the two driving factors, insurance costs and pharmaceutical costs, is what's driving the majority of the costs in healthcare. So we feel we can bring that down a little bit more. And again, I talked about earlier, going to a single payer system, we're looking at anywhere from 30 to 50% lower costs on premiums. So we just talked right there how we can lower costs twice and how we can cover the high-risk pool. So those are easy, simple ways. I'm not saying easy or simple, but those are simpler ways that we can do, that we can streamline our government to basically lower the healthcare costs. Now let's talk about quality. Quality is very important. Today in New Mexico, the experts are telling us there's over 300 doctors that were short, over 3,200 nurses, and 1,600 physician assistants. So one of the things is you've heard me talk about this in our economic plan. We need more doctors in our communities, now specifically in our rural communities. Now how are we going to get more doctors here? Because we've had many conversations about it. Number one, between UNM Medical School and between Burrell School of Medicine down in Las Cruces, within 2 years, the Burrell School down south, general practitioners, will be graduating roughly around 200 medical students a year, general practitioners. Our school, the University of New Mexico, graduates between 100 and 120 students a year going into the residency programs. And the University of New Mexico tells me that they turn down 300 to 350 students a year in residency programs. Now, if you don't know this, you've heard me talk about it, that UNM Medical School, a medical research institution, is one of the top medical institutions in the country. So our proposal is, let's invest, there's that word again, let's invest in New Mexico into our strengths. So we have UNM Medical School, and we have the Burrell School that's going to be pumping out within the next 2 years about 200 general practitioner doctors. How do we motivate those doctors to stay here? Our proposal is, let's expand our residency programs in the state of New Mexico. We would say by 300. UNM's telling me you probably only need about 100. Burrell's telling me they need about 100. So I would propose, let's expand our residency programs in the state of New Mexico by 200 to 300 residency programs a year. Yes, it would cost us about $10 million to invest in those programs. Then our proposal is, let's have those residencies go through medical school, go through the residency programs. On average, they're going to come out with about $150,000 in costs. Then you stay in New Mexico, you go into the rural communities, you go into communities that we need you in. We will pay for your residency and your medical schools, which would cost about $150,000 per student, per residence, in those rural communities. Now, I'd ask you for a 7-year commitment within that, okay? Now, doing that, every doctor we put into your community will generate $1.6 million of economic growth in that community. Every doctor we put within that community creates 3 to 6 new jobs. So by putting 300 more doctors into our residency programs, we would generate literally $600 million, almost $600 million of new economic growth in our state. And yes, this program that we're talking about would cost us roughly $30 to $40 million, but the economic growth within those doctors, with the program, you can see the numbers, the program literally pays for itself within 4 to 5 years. And I've talked to UNM Medical School about it, I've talked to Burrell School about it, I've talked to medical experts about it. Those are ways we can grow the economy. Those are ways we can get more doctors and have access to them. So those are the things that we're going to, those are opportunities there. And we have to push more nurses and physician assistants. Now, you've heard me talk, Jackie and I, you've heard me and Jackie talk about our foundation, our scholarship programs for nursing programs. We actually created a scholarship program. We were giving it to young kids, but we moved it to a nursing program because by helping nurses get their physician's assistants, or by helping nurses get their degrees, they actually get paid more. Our state universities actually get more federal funding, so it's a win-win for everybody. So we would also push for 3,200 more nurses, 1,600 more physician assistants, and making sure there's scholarship programs, and we would offer the same benefits of, hey, nurses, physician assistants, you go work in these rural communities, or you go work in the areas we need you, we will create a 7-year plan for you too, to pay back into those schools. So I hope I'm making clear about that. Now let's talk about access to care. It's key in the state of New Mexico. In fact, let me make this very clear to you. We lose hundreds of millions of dollars a year in Medicaid funding to Colorado, Arizona, Texas. And you're going to hear me talk about our regional states all the time because we lose business to them all the time. We also lose Medicaid and Medicare coverage for that purpose because they go for medical care and access into those areas because either we don't provide it or it's more convenient for them. So our proposal is that we would invest into more urgent care centers, more hospitals, expanding our hospitals. Right now, what's happening in our state that's driving our cost up again is a lot of our the high-risk pool or non-insured or other people out of that mindset, they're going to our urgent care, our emergency centers, our emergency rooms. In fact, I made a joke with Presbyterian when I've talked to press about this. Is Presbyterian would literally save probably 80% costs out of their emergency room if they just created and opened an urgent care center next door. Because people are so used to going to the emergency room. Now, I was at the emergency room, not me myself, I was there visiting a friend in the emergency room about a year ago. And I was there for a couple hours, and I walked around the emergency room, and I noticed that probably 80% of the people within the emergency room didn't need to be in that emergency room. But our mindset is, let's go to the hospital and go to the emergency room. So as long as we give more access, as we give more affordable health care and preventative and investing into those areas, we're going to drive our costs down a little bit more. So I hope that makes sense. Also, there are 2 New Mexico companies today. You're going to hear me talk a lot about telemedicine. Now, telemedicine means you can literally be in Las Vegas and talk to a doctor here, a specialist here at UNM Medical School, or at Presbyterian, or at Loveless, and we can create a network of doctors. We can even do doctors outside our state. If you need a specialist in Colorado, in Los Angeles, you can do that too. There are 2 local New Mexico-based companies that are pushing telemedicine. I think it's a great opportunity that we can get doctors and physician assistants immediately into those communities so you can see a specialist. You can literally, it's over your computer, and you can be taken care of and see a doctor over via telemedicine, telecommunications on your computer. Now, you need to get to that doctor, then we can get you to the doctor. And as we expand our doctors across our state, physicians, physician assistants, and nurses, telemedicine is something that we can do immediately. And I think we should be funding that. One of the things you also might have heard is the ECHO program, which is sharing communications and information out of the University of New Mexico within telemedicine, getting to that. And that's a very productive area for UNM. I just think we need, the biggest reason you aren't seeing telemedicine and ECHO being expanded in New Mexico, it's about funding. You're going to hear me talk about that, right? We've talked about that. We have $23 billion and we don't fund anything in our state. So those are things that we can talk about as we move forward. Now, by doing that, we will keep millions and millions of dollars of Medicaid and Medicare funding that goes outside our state, right here in our state, to give us more funding. So those are ideas with telemedicine and ECHO. And then let's talk about our veterans real quick. You know, we have a great veterans hospital here. When I talk to veterans, the biggest issue they have is backlogged. And when you really dig into it, it's about doctors, nurses, and physician assistants. So if you talked about in our when we talked about our educational plan, it's about investing in creating pathways for doctors, nurses, and physician assistants to make sure we get into that area. So those are the 3 things relatively easy, not easy, but relatively that we can do in healthcare costs, that we can drop in lower healthcare costs. Now let's talk about some other things too. One of the things that we're pushing and proposing, specifically with single payer, is healthcare centers within our schools and our communities. We know that 25% of our rural communities, 25% of our kids live on some type of impoverished community, on some type of, live under the poverty line. So they have no healthcare costs whatsoever. So our goal is let's put those healthcare centers and urgent care centers, community centers with nurses, physician assistants, and even a doctor, we can do it with telemedicine, within our communities, within our schools, so our kids are getting care. I mean, that's a pretty simple, basic thing that we should be doing. And there's already programs out there. And Atrisco High School and some other high schools, right, already have some of those programs. I'm looking over at Shay here. So Shay's smiling at me, so I guess I'm right, Shay? Because I know Atrisco. I always bring up Atrisco because I have friends that work out there, so I always get that. But Atrisco actually has a health facilities on premise for their students. And then I believe at 1, 2 o'clock in the afternoon, they open it up to parents and to the general public, and it's tied to UNM Medical School. Again, residency programs within our kids, helping our kids out. And keep in mind too, a healthy kid is a learning kid, and it helps both with early child education, early child development, and educational programs. When 25% of your kids live in poverty and they're worried about their health, they're worried about their dental care, they're worried about where their next meal's coming from, it's amazing how they don't learn. We bring that all together within our communities. You're going to hear me talk about it, Community Up. We bring all that together. I think we do that. Our veterans hospitals. We have to start taking care of our veterans better. Now, the Veterans Hospital is great. There's literally a proposal that I've talked to between the private and public sector to invest and make a 360-degree regional veterans center. But we also have to get our veterans in northern New Mexico and southern New Mexico, the rural communities that have to travel 4 hours, 3 to 4 hours to Albuquerque for the veterans. There's no reason for them to do that. As we expand urgent care centers, as we expand regional care centers and hospitals with the private-public partnerships, right? Financially, not that they're going to be run privately, but financially, using our medical centers in UNM, Burrell Medical School, our veterans could be taken care of. And now, if they need a specialist with telemedicine, they can be diagnosed right there, right then in their community, and then we can get them to Albuquerque if they need specific surgeries or specific treatments that they can't get into their communities. Folks, these are simple, easy ways to do it. The number one issue is they need funding. And then we sit on $23 billion. So as we grow our economy, as we grow jobs, as we invest into ourselves, these are programs that we need to invest into that's going to create opportunities. Now I'm going to try and speed this up because I just realized we're about 20 minutes into it and I do want to get to some questions. Mental health. Mental health is a major issue. And today we talked about it, actually there's a good tie-in last week. Last week we talked about criminal justice and how we spend $221 million a year in incarcerating nonviolent criminals, and we know 6% of them are mentally ill. So we need halfway houses or stepway houses for about a year. You go to Las Vegas, New Mexico, they have a health program there, they have a health hospital there, a mental health hospital there that we need to expand and invest into. But when we release them every 3 to 6 months, there's no halfway houses or there are no houses to help some of these mentally ill. And so we need to make sure that we're giving them treatment. We need to make sure they have facilities. We need to make sure they're having treatment and training for opportunities, not just walking around the streets. And so I think those are things there. Now we know what happened with the mental health facilities is 15 were put out of business. And now they're in a major lawsuit with the state. So our proposal is let's settle that lawsuit. Let's get these 15 New Mexico-based companies that Governor Martinez put out of business and let's get them back to work taking care of our mentally health and mental health patients. And instead of incarcerating them, spending $221 million on incarcerating non-violent criminals, let's move that to health and training programs. So I hope that brings it up. The last thing I want to talk about before we open up to questions is the opiate addiction. It's a major, major problem in our state. In fact, we're still one of the leading states, and some of our counties have the leading state. And there was a poll the other day, or a research thing the other day that came out that said that the state's actually getting better because now I think we're ranked 12th or 13th. Yes, we had 6 less deaths last year versus the year before, but we're still very high indexed. And actually, we haven't gotten much better. Other states have gotten worse. So let me make that very clear. Other states have gotten worse. And again, we can talk about cannabis and medical cannabis, but I've talked to experts in Colorado and Oregon. By legalizing cannabis for adult usage, by expanding the medical institutions for that, they've actually seen a 25% drop in opiate addiction in those communities. So those are things we have to take a look at. And yes, when it comes to meth centers, opiate centers, things like that. And now we talked about it last week. We have to invest, we have to decriminalize some of these issues. We spend over $200 million, $221 million a year to incarcerate that 35%, which are basically opiate or meth addicted people that all came from starting the gateway they've told me, the experts are telling me, is prescription drugs. And we are going to monitor and manage what they call pill mills or pain centers because they have gone rampant. And one of my opponents voted for a bill in Congress that took the teeth away from the DEA to shut down or clamp down on these pill mills just for the pharmaceutical companies to get those pills out there in our community that has created huge opiate addiction and has started this problem. And I've talked to 3 former CEOs about this that used to be pharmaceutical companies that were totally against expanding these pill mills. And now we've seen what has happened in our state. Anyway, I've been talking for about 20 minutes, I believe, Shay. And so I know that's way too long, but I think that's a lot of things. So that's kind of our health plan. I know it's a lot of information. We'll post it on our website. We'll talk about it. But just to summarize, our goal as governor is affordable, quality, and access. We believe in single payer. We think that'll bring costs down for everything. We believe in controlling pharmaceuticals and generic pharmaceuticals, our own. We think that'll drive the cost down. And then we have to invest and decriminalize opiate addiction, pill addiction, and instead of locking them up, let's treat them on two-year plans, not 2 to 3 month plans. Let's treat them on 2-year plans, and let's invest in giving them training and job opportunities. We know by treating addiction instead of incarcerating them, it costs us 75% less money. So within 4 years, that $221 million literally goes down to about $60 to $70 million, and we're saving $150 million a year that we can put into education or additional healthcare issues. Okay, so I'm done talking. I think that's okay. Let me go to some questions real quick because I know we're trying to keep these at 30 minutes. I think we're going to go over a little long today because we're at 25 minutes. And here's some pre-questions that we got. We got actually 4 or 5 pre-questions today. Dee from Albuquerque. Dee, welcome. I don't know if I see Dee on, but she emailed us about, do you support Medicare for all? And we do. I think we've talked about single payer. The New Mexico, New Mexico Health Securities Act. We would support a single payer system like that. So I don't want to go too much into detail, Dee, because we already kind of talked about that. We need more medical. This is from Richard and Bernalillo, and Al from Vegas actually sent us a very similar question. So I'll just combine it. We need more medical professionals in our state. How will you work on that? I agree with you there. We talked about that. We're short 300 doctors. Now, some people have already told me it's different, but we're short about 100 specialists. We're short between 200 to 250 general practitioner doctors. And Rich and Al, our proposal is to invest into a bigger residency program using both the Burrell School and the UNM Medical School. By investing about $10 million, we think we can expand it by up to 200 more residencies a year. University of New Mexico actually declines almost 300 residency doctors. UNM has a great residency program. I've talked to them, I've visited with them. They feel by us expanding the residency program by 100 doctors, some people think 200 doctors, that we can literally get 200 to 300 more doctors in our system. Now, we can also recruit doctors. We can recruit doctors into our state. We can recruit doctors from Mexico, South America, Spain, Spanish-speaking doctors to come here. Since 50% of our population is Hispanic and over 70% of them speak Spanish, I think it's a good access to that. So I think we can do that. That's one of our plans. Wendy, and I don't have Wendy from, I don't know where Wendy's from, but Wendy, what will you do to lower prescription drug prices? Wendy, we talked about that. Our proposal is, look, if you want to use brand names, we're okay with that. And if your insurance and insurance wants to cover that, you want to pay for that, we're okay with that. But today, Wendy, 50% of New Mexicans, over 50% of New Mexicans, some type of government program, Medicaid or Medicare, which means 50% of New Mexicans are on some type of government program. So my proposal is, and I use generic drugs, our proposal is, let's bring generic drugs in through Santa Teresa, which is basically being manufactured out of India and in Israel, which are the two main countries I've been told. And let's bring them into New Mexico. All we have to do is repackage it with FDA regulations, and then the state can sell it at cost to New Mexicans. And that would basically save us almost 80% cost on prescription drugs. Now, if the Smiths and the Walgreens and the CVSs of the world don't want us to get into their business, then I would propose that let's work with them and cut down our costs and drive our costs down. So that's one of the biggest things. This has come up a couple of times. John, I think it says Placitas, but I apologize, John, if you're not from Placitas. Cannabis medical plants, PPL licenses, are you for or against? I hear you only for 3 plants. I think, let me clear this up. We had a cannabis forum the other day, about a month ago, and I think there was some confusion on my part. So John, that's a very good question. In the state of New Mexico, they're called PPLs, personal production licenses. They're medical patients that either don't have access to medical cannabis centers or they can't afford it. So the state allows you to get a PPL license to grow your own cannabis for medical purposes. Now the state allows 16 plants. In fact, I think they just expanded it. The state allows 16 plants. Now look, I'm not a cannabis expert whatsoever, but what I've learned is there's a 3-stage process, right? There's the agricultural growing side of it, and then there's the flowering side, and then there's the harvesting side. So your plant is going through that process, the 3 process steps the whole time. So what New Mexico does is they allow you to grow 4 plants, right? Because they're growing. Then you have 4 flowering plants, and you have 4 harvesting plants. I don't think it's called harvesting, but something like that. And that allows that person to have their own medical. I'm okay with that, John. I think the confusion was, and I probably confused the situation in our cannabis forum, is I said I'm for 3 plant licenses. Now what I was talking about there is we were talking about adult usage, and we were comparing New Mexico, Colorado, and Oregon. And to my understanding, what Colorado allows is they do allow, on the legalization, they do allow individuals to have up to 3 plants for personal use. I'm okay with that, and look, I'll talk to the cannabis industry because they're the experts. I'm okay with that. What I just don't want is to creating a black market. So John, I would agree with keeping the PPL licenses in New Mexico at 16 plants. Everybody seems okay with that. On a personal use, if we ever legalize adult usage in cannabis, I would be okay with that. By the way, we're the first campaign to say we would legalize cannabis adult usage, by the way, if you haven't heard us talk about that. So thank you on that question. I hope I cleared that up. Shay, I hope I cleared that up. One question we got from Randy, and I think it's Las Cruces. The New Mexico Health Security Acts, will you support it? And what happens if a governor comes in afterwards? We have said publicly that we would support the New Mexico Health Security Act. Now, if folks don't know what the New Mexico Health Security Act is, Basically, if we pass it and sign it, it does allow the state to create a single payer system. Now, I've actually read it very thoroughly, and I've talked to attorneys about it. The only hiccup I have with the New Mexico Health Securities Act is that the governor and an advisory board has control of it. And my issue is that, as governor, I don't think any governor should have control of any single payer system. So I'm for the New Mexico Health Security Act. I just don't want the governor to have control of it, because let's say I'm for a single payer system, and after me, the next governor comes in and they're not against this. They're not for a single payer system, and we change the whole system. So that would be one of the things I would want to make sure is it's an independent arm of our government that's running the program. So those are the first questions we got. Here's, I think we got 2 or 3 more. And we're at the 31-minute mark. I hope I'm answering your questions a lot. And I see there's a lot of people here today, so that's great. Justin, and we don't know where Justin's from, I guess. Justin, will you support supervising injection sites in the state? Am I reading that right? Also, will you support medication assistance for therapy combined with consulting?
Counseling.
Oh, counseling while people are still in care. I don't understand. Incarcerated. So I don't understand the question. Will you support supervision of
Supervise injection
sites in the state for medical assistance, therapy combined with counseling? Justin, I actually don't understand the question, and I don't think Shay does. So if you can clarify the question, but if you're asking me incarceration folks about supervision and medical care, I want to make sure that we have very good medical care within our prisons and our prison sites. Also, one of the things that we've talked about, and I don't know how we can really implement this, but I've talked to some religious organizations that go in and help prisoners and help within our system, and they have found actually licensed doctors in our prison system for whatever reason, whatever laws they broke and are in the prison system, that aren't allowed to practice medicines. So I don't think this is your question, but Justin, what I think would be a good idea is that we would allow doctors or trained doctors that might be incarcerated for whatever reason to be able to practice in our system.
We have his email. We'll email him answers.
Justin, we have your email. We'll follow up an email with you because I don't understand the question, so thank you. Tyler from Albuquerque. Sorry about that. What will the education and prevention services addressing addiction look like? Will you include it into the school systems? Absolutely. Is that Tyler? Tyler, absolutely, Tyler. We have to bring education back into the system. In fact, one of our proposals with legalization of cannabis for adult usage is 25% of the tax revenue we would actually use for education within our schools, prevention and prevention systems. And then one of our goals is, as we move our community service or health service programs, very similar they have at Atrisco High School and other schools already, as we go into the communities, we would have an educational plan and programs basically working with prevention and services. And again, we have $21 million that we incarcerate people with. Once we start treating them and stop incarcerating them, we'll save $165 million, and our goal is to move that money into these type of programs and into healthcare to bring down those costs. So, Tyler, I hope I answered your question. Charlie, and I don't know if this is Charlie from Las Vegas, because I see Charlie, my friend from Las Vegas, is on preventative healthcare and what is that word? Kind of love your handwriting.
And holistic health.
Oh, holistic. God, your handwriting is about as good as mine. Actually, your handwriting is better than mine. Preventative healthcare and holistic healthcare. Charlie, that's a good question. Holistic, in fact, Jackie's a big believer. My wife, Jackie's a big believer in that. It's about taking care of health prevention. It's about eating healthier. It's about exercise. It's about nutritional ideas. And so when we talk about, Charlie, we talk about agriculture. We talked about agriculture and growing our own and importing ourselves and then exporting. Those are things that we can look within agriculture. And then preventative and healthcare, again, educational-wise within our schools and our school systems. Jackie and I are very good at this, and we see our children. I mean, we have one of our kids, Asher's kind of like a health nut at 9 years of age. But I do believe in preventative healthcare. And again, you go back to the single payer system, that's one of our proposals, is preventative healthcare. Let's see patients before they get sick. Let's make sure everybody with a single payer will be able to see a doctor and telemedicine doctor once a year, physician assistants once a year, and go into those urgent care centers or go into the centers that we want to expand. And by the way, we want to work with Presbyterian. We want to work with Loveless. We want to work with Blue Cross. We want to work with the health industry to streamline it and make sure it's a turnkey solution for all. So it's not like we want to kick anybody out.
Justin clarified his question on your feed if you want to look at it.
Okay, Justin, hold on real quick. Let me get to the, I'm assuming it's the bottom.
It's right here. Justin, right up here.
Comprehensive drug treatment during incarceration includes individual and group counseling and opioid replacement. Okay, I get it. Justin, yes, I get your question now. Yes, we believe in counseling and treatment centers. In fact, one of the things we've talked about with opiates, and I hope I'm understanding the question, Shay. One of the things that we've talked about with our opiate addiction in our centers is moving that $225 million, decriminalizing nonviolent criminals and moving them into rehab, counseling, training programs for 2 years. Long-term care outside private, long-term care for government is 2 months, when the experts are telling us 2 years. So yes, we would start within the prison system, within the incarceration system, and then we would move that to the outside system. And again, our long-term goal is let's decriminalize that. 35% of the people we incarcerate are addicted to something. We want to move that money over and decriminalize it and create treatment centers within the communities. Now we know there's some great programs already out there. Jackie and I have toured some of them. Our goal is to make sure they get funded and get fully funded to make sure we're helping these kids. Now, also, Justin, one of our platforms on the educational side is early child education, but also creating pathways and creating opportunities for our kids. So we see other communities, we see other states that have done this, and they see the drop in teen youth and teen opiates and teen addictions drop because kids have things to do and they see hope and opportunity. And that's what it's about. Now we're at the 38-minute mark. I think we have one more question. I'm not sure. I think we have one more question. Can you ask?
Nikki from Albuquerque.
Nikki from Albuquerque. What can be done to better regulate healthcare providers to ensure quality healthcare that is given to improve? I'm sure that there are lots of people out there who can relate going on to see PCP treatment centers, blah, blah, blah. PCP can change the specialist copay. Regulate healthcare providers. I'm not sure if I totally answered the question or I totally understand the question, but I think what Nikki's asking is monitoring healthcare providers.
Yes.
Okay. I think again, Nikki, going to a single payer system and expanding doctors and expanding healthcare, we can monitor that and monitor the copays. The goal is to lower our costs, create affordable healthcare costs for all. So I hope I answered your question. I think we covered it. Did I cover it, Shay?
Mm-hmm.
Okay. We're going to take one more question because Shay's writing really quick. And let me talk to, I see Vegas Fulgenzi here today. I haven't seen Vegas. Hey, Randy from Las Cruces. Why don't drug companies help foot the bill for rehab centers for not passing on, instead of passing on to consumers? Randy, that's a very good question. So again, drug companies, they make their profits off selling their drugs. So a couple things, Randy, that we want to do. First of all, we want to make sure we're monitoring and limiting the pill mills, that they call them, that are giving just prescriptions out. That's one of the issues that we've seen across the board. And one of our opponents actually voted for a bill that took the teeth away from the DEA to basically lock down on overprescribing drugs. So that's the first thing we want to do, is lock that down. The second is, I think we can basically create our own generic drugs for our own New Mexico patients and drive our costs down that way. Also, with a single payer, Randy, we would have 1.7 to 2 million people within the system. That would actually give us more leverage with the pharmaceutical companies to negotiate pricing down for everybody. So I don't know if we could ever foot the, I mean, the pharmaceutical companies are paying a tax. They're paying grocery receipts tax, as everybody does. You know, can we increase those taxes to have them, help them cover some of those costs? Absolutely. We can talk about that. That's not one of the things we talked about. But one of the things I want to do with the pharmaceutical companies is if we have a single payer system with 1.7 to 2 million people, if we have a generic program that New Mexico controls and they don't control, we then have leverage, right? As George Costanza said in Seinfeld, we have hand. We then have hand. Shay's laughing at me now. We have hand to basically negotiate our pricing down and lower our costs. Now, we've run the numbers, Randy. We think we can lower our costs by almost 80%. So instead of going to the pharmaceutical companies and charging them or hitting them with a tax or a tariff, whatever you want to call it, we feel that if we negotiate with them with a single payer system, we can actually get the pricing down by 80% on our pharmaceutical costs. So I'd rather look, I think that's more efficient than just going to them and say, hey, let me tax you, because all they can do is drive the cost up, right? So I think we can do that more. Randy, I hope I answered your question. We're at the 40-minute mark. I hope I answered everybody's questions. Thank you very much. Now look, take a look at our campaign. Keep following our campaign. We really need your support. Any delegates out there that are undecided, that see this between now and Saturday, I would ask you to vote for us at the convention this Saturday. Get us on the ballot. Make sure we're on the ballot, because I think the most important thing for New Mexico is our campaign's really picking up steam. The North, the South, and in Albuquerque. We will win this thing. We have 6 different pathways to victory, but we need your help. So whether that's being a delegate, talking to your friends, getting the word out there, but the battle is going to start basically next week when we finalize who's going to be on the ballot, and let's go at it. I challenge my opponent, specifically the Congresswoman, who has not agreed to any debates or any forums. I will do a debate or forum once or twice a week. I think it's important for the people of New Mexico to see our differences, to see our plans. We've gone over our healthcare plan. You've seen our healthcare plan, and we can do a single payer system, lower cost for all, lower cost on the pharmaceutical side. You've seen our jobs plan. We can create 225,000 new jobs for our state. So folks, it's time. This is the moment. It's time we start looking at new ideas, big ideas, major change for New Mexico, and that's what our campaign's about. So thank you so much. Now, this is the 8 weeks. We've talked about our platforms. This has become so popular and people like it so much that we're going to continue doing Turnaround Tuesdays. We really don't know what the topic's going to be because we talked about our platform for the last 8 weeks. We've broken it out. And so here's what I challenge you. I think I know what I want to talk about next week, but what I'd like from you is, why don't you email the campaign at info@apo18.com. That's info@apo18.com. You tell us, or post something on our Facebook. You tell us what you want to talk about next week. And if you want to go over something that we've already talked about or something of our platform, absolutely. Whoever gets the most responses, and sometimes maybe we'll just come in and it could be a weekly topic. But we've gotten so much positive feedback, and over 2,000 to 4,000 people a week are watching these Turnaround Tuesdays. We're going to continue them through the election. And as your governor, we will have Turnaround Tuesdays as governor from the Capitol, from my office. So instead of my father traveling around the state having open office hours that he did, I thought we would have live town halls like this so the community can talk to me and we can streamline it. So anyway, thank you all so much. Thank you for the questions. Thanks everybody. I do see some new names in here today. So thank you for joining us. God bless you all. Let's fix our state together. Let's turn New Mexico around. Let's invest in New Mexico. Follow our campaign. We need your help. If you're in one of the cities with the mayor's race today, it's important to get out and vote for the mayor and vote for the New Mexican that's going to take care of you, that's going to invest in you. Thank you all so much. We'll see you next week.